Sure. That's the mastoid bone, styloid process, external acoustic meatus.
Okay. The styloid's the little thing that hangs down.
Yeah, the little, like remember old record
okay.
players?
Yeah.
Everybody here remember the record player?
Yeah.
Y'all, you remember record player, right?
I have two.
You have two, okay. The stylus, okay, so that kind of looks like the stylus of a record player. A lot of swallowing muscles attached there. You'll be seeing those like stylohyoid, styloglossus, stuff like that. Okay, what have we got? Internal. All right, let's look at the different parts of the temporal bone. Let me open this up. Now, the squamous portion of the temporal bone is what you see here. You can see it pretty clearly in your textbook. This is the squamous portion of the temporal bone right out here. And that's the squamous suture. When we come inferior, we go under the skull, that's the petrous portion. And let's look inside. The petrous portion is where the ear organ is. So this is the petrous portion in here. The petrous portion here. You'll see that? If we go underneath, this is the petrous portion. It's kind of flattened out in your textbook so you can see it better. All right, let's see if I can find this without looking at the picture. I'll probably have to look at the picture. No, I know where it is. Okay, let's do mandibular fossa. The mandibular fossa is where the mandible articulates with the temporal bone, and you have the TMJ. Y'all have heard TMJ, right? Temporomandibular joint. So you see where the mandible articulates. There's a fossa there. That's the temporal fossa. Whoops, turn it that way. Can you see that? And you got one on each temporal bone. Gives you some trouble sometimes. Folks have trouble with that. All right. We talked about the different processes. You see this that comes off of the temporal bone here? You see that right there? That is the zygomatic process of the temporal bone. It goes towards the zygomatic bone, so it's called the zygomatic process of the temporal bone. And you have a little suture there so you can see where it articulates with the zygomatic bone, right here. Zygomatic process of temporal bone. Students frequently get this confused because here's the zygomatic bone, so what would you call this side of that articulation?
Temporal process of the zygomatic bone.
Right, temporal process of the zygomatic bone over here. And the two of those together make up what's called the zygomatic arch. And that's what forms your cheek, the whole cheek. And nothing but the cheek, no. All right, got that. So the two most difficult things then to find are the jugular foramen, and that is where the internal jugular vein comes down to drain blood, deoxygenated blood from the brain, and they're kind of these little kidney bean shaped canal here. If you'll look, we'll look from the inside. That's the jugular foramen here and here. So you have a right and left internal jugulars. And then the other is the what is it called? Carotid canal. And it's supposed to go all the way through because it takes the internal carotid arteries to supply the brain, but they didn't make it go all the way through, so this is the carotid canals here.
Right here?
You see those? Yeah, right. They're just anterior to the jugular foramen.
Oh, so
They're just, if you hold it like that, it's just anterior to the jugular.
Okay.
It's supposed to go all the way. It's actually like a canal, so it may actually... No, that's the internal acoustic meatus right there. See, the hearing organ is in the petrous portion here. Okay, so we've got the middle ear and the labyrinth system are all in here, in there. So this is the internal acoustic meatus here and here. You see that? You see that internal acoustic? And what comes in from here is what's known as the vestibular